failed you. As the Animal Welfare Committee Chair, I've been awed by the leadership and teamwork of our committee members. In the nearly 5 years that I've chaired this committee, I've witnessed an amazing transformation of our small group and of our impact. If you are a member of the Animal Welfare Committee, please stand so I can take attendance. I know there are more of you out there. Thank you so much for your commitment to our profession. I'm so excited to introduce our next speaker. Dr. Duncan is the Chief Veterinarian at the Detroit Zoological Institute. She is a graduate of Michigan State University's College of Veterinary Medicine. She completed an internship in zoological medicine at the University of Tennessee and Knoxville Zoo. She has been at the Detroit Zoo for almost 20 years, providing medical care for the zoo's diverse collection of over 3,000 animals. In 2003, she was chosen as one of Crane's Detroit Business's 40 under 40 influential people in the Detroit area. Please welcome Dr. Duncan. Here.
Okay, can you hear me all right? Is it loud enough in the back? Okay, well this is a little bit off topic maybe, but I'm going to share with you a story of trying to do the best for the animals that are in our care at the Detroit Zoo. And this story starts with this silverback male gorilla. His name was Sunshine. And usually I have about 12 favorite animals at the zoo. And Sunshine was my favorite animal at that time, one of my 12 favorites. He was a beautiful, very, very large, majestic male, and he lived with our 2 females. In 2008, he suddenly became sick. And knowing what we do about gorillas and the health problems that they have, our 2 primary rule-outs were either pulmonary or cardiac. And unfortunately, as we were preparing to immobilize him, he passed away. And there was an extreme sense of frustration during the 6 or 8 hours that we were preparing for his immobilization, because we knew he was a very high-risk animal in terms of anesthesia, and we wished that there was some way that we could tell what his problem was before we entered into his procedure. And we recognized that we needed to do better in terms of figuring out what their problems were before we had to do anesthesia. The other thing that we knew at that time was that if we did a cardiac ultrasound on him under anesthesia, that there were no normals for gorillas, that we would be using human normals, and that might not serve us well. We know that about 46% of the deaths in gorillas and 35% of the deaths in chimpanzees are due to cardiovascular disease. And in fact, males have a very high incidence of 70%. They can begin to have cardiovascular disease when they're very young, and they usually present with sudden death. You don't realize that they have a problem, and then you suddenly have a very ill animal, or even worse, an animal that has died suddenly with no clinical signs whatsoever. They have a different form of heart disease than people. They don't develop plaque in their arteries and then the myocardial infarctions and strokes that we do. Instead, there's a process where the muscle fibers in the heart are replaced with fibrous tissue, and that decreases the contractility of the heart muscle, decreases the ejection fraction, the amount of blood that can be pumped with each beat, and also can interrupt electrical conduction in the heart muscle and therefore function. It can lead to atrial fibrillation and death. And so, in response to this, the zoo community has a very, very large effort called the Great Ape Heart Project. And this is, it's large scale, it's grant funded through it has IMLS grant, and it's a conglomerate of zoo veterinarians, veterinary cardiologists, human cardiologists, epidemiologists, nutritionists, and other people who are trying to pick this apart. And there's a massive database that's been assembled using ultrasounds from gorillas all over the world and other data, pathological data, putting all of this together to try to paint a full evidence-based picture of what's going on with these animals. The project's goals are to develop diagnostic tests, establish normal values, and come up with treatments that will work. And we also, at the heart of this, we really want to better understand what's causing this so that we can reduce the incidence in captivity. We know that there are gaps in our understanding, and I'm only going to mention 3 of them. We don't know much about the onset of disease. We don't know what treatments might be most effective, and we don't know the role of arrhythmia. So after we had Sunshine and his 2 females, we brought in a group of bachelor males, 3 of them, and we decided to start working with them to try to fill in some of the gaps. In terms of training, we had had some success. We had trained 2 of our female chimpanzees to allow us to ultrasound them while they were pregnant, and were able to follow their pregnancies all the way through. In one case, one of the females was pregnant with twins, and so that was especially helpful. We had tried for about a year to draw blood from our 3 gorillas and had failed. We worked really hard at this, but we did not succeed. And we knew that other zoos had trained their gorillas for cardiac ultrasound. And so we knew it was possible. And we decided to, because we thought we could get more information from ultrasound than from blood sampling, we decided to switch gears and train for ultrasound. We set a goal to train our 3 young male gorillas to cooperate for awake cardiac ultrasound exams. And part of this was that we purchased a new ultrasound machine in 2012. But even before that time, we were using our old machine to train them, to start to train the behavior. And it's our Operant Conditioning. I'm sure you've heard of it. It's used in all kinds of animals and even in people. And basically, you have to break the behavior down into small, small steps and positively reinforce them as they learn the different behaviors. In our gorillas, we're lucky, fortunate that we're able to use their regular diet. They will work for their chow. I don't know why. They haven't figured out they could hold out for something better. Although my most recent ultrasound with Chip, he would not participate for about 4 months, and I had to break down and use donut holes for him, and it worked great. So I may have upped the ante already. We found as we were training them that everything went swimmingly until it was time to apply gel. Of the 3 males, 1 of them would leave the gel on all day long if he had the option, and 1 of them steps back and goes, and I can't do this because of the mic, but he goes every single time you put the gel on him. But despite those challenges, it took us only 1 to 3 months to train the gorillas to allow awake ultrasound, which is pretty good. That sounds actually really quick, but that's a lot of hours. We had to start very basic by getting them used to me being there, by getting them used to the machine and the little noises that it would make when I would press the buttons. And so I visited them at least twice a week for that entire time in order to train them. I also had to learn how to do it myself. Human ultrasound is done completely opposite from veterinary ultrasound, and I'm not really even that good at veterinary ultrasound. So I practiced on teenage boys. I have one, so I used him as my guinea pig. So I'm going to show you a video. I'm actually going to Alt-Tab. And then this. And then do this.
All right, we're excited about this next story. For the first time ever, only Local 4 cameras were allowed on a really special behind-the-scenes exam at the Detroit Zoo.
Prepare to be amazed. They invited us along as their lead veterinarian gave heart exams to the 3 male gorillas. Just like male humans, they've probably been putting it off, you know. So we sent photographer Alex Atwell out there for a look at the work done at the zoo that is uniquely Detroit.
All 3 of our boys have very unique personalities, and it's been fun to get to know them. My name is Dr. Duncan. I'm the chief veterinarian at the Detroit Zoo. On the days that I'm going to come in and do gorilla ultrasound, I always look forward to it. It's really, really fun to come up here. I love working with the individual animals. Can you do ultrasound today? You're ready. Okay, let's do this. I'm ready. Ready? Ready. Come up. Good. Oh, we're going to be super tall today. What you saw today was us doing an awake cooperative ultrasound on our gorilla males. Good boy. Good stay. Heart disease affects about 46% of gorillas. Essentially, we're trying to understand heart disease in gorillas better. Can you put this up here? This one up here. I know you can reach it. Thank you. And so it's probably the most important disease condition in gorillas. Come on, up here, right here. And that's why we want to get ahead of it, diagnose it, track it over time so that we can better understand it, and if possible, treat it and stop it from progressing. Good. Stay. Stay. Over a 3-month period, we trained our 3 males to allow us to do the ultrasound. Ready? Good job. Chest. They have to come over and present their chest. Good boy, good stay. In a wide open posture. They have to stretch their arms up high so that we can get their rib cage open and image between the ribs. And then we put the probe on their chest with a little bit of gel, and we're able to capture moving images of the heart. So this is the left ventricle here of the heart, and the atrium and the valve in between. And this is the right side of the heart, the right ventricle. Good boy. Good, stay. From those images, we can measure the heart wall thickness and see how thick the heart wall is. You're doing good, buddy. Doing good. We can also see how well the heart is contracting. We can see the heart rate while we're doing the exam, and we can see whether or not the valves are functioning normally. Good, stay. In people, the arteries clog up with plaque, and then you end up with small sections of heart muscle that don't have enough blood supply. In gorillas, it's very different, and in fact, the heart wall thickens instead, and then over time, it can't function normally, and the amount of blood that the heart can pump with each beat decreases. Good now? One more time? So that's what we're looking for, and we think we see that already in 2 of our males. Because we see heart disease, we have those 2 males on the same medications they would use to treat heart wall thickening in people. And we're very much hoping that over time we'll see that their heart disease doesn't progress and maybe come up with effective doses for stopping this disease from affecting gorillas. Right here. Good. Give me a second. Each one of them has responded really differently. Congo is a rock star. He's the one that you videoed today, and he does really, really well consistently whenever we come up to do ultrasound. Stay. Good, Congo. Pende is the curious and handsome one. He's definitely the cutest one, if you ask me. He's kind of my type. Chip has been kind of standoffish and aloof throughout this project, so it's been especially rewarding to gain his trust. Good boy, you're okay. I find it the most rewarding to try to understand diseases better and prevent them from occurring in the first place. Okay, great job. I have explained to all of them that this is really important for their continued heart health over time. I don't know if they understand that or not, but it is nice that they enjoy the work and they enjoy spending time interacting with us to get this project done. You did good today. You did very good today.
All right, one of the coolest jobs ever. Don't you agree? Joining us now live in studio is Dr. Duncan with the Detroit Zoo, and we really appreciate you coming in because we know you're busy.
Yeah, but it's a pleasure to be here and to talk about this work. It's been really fun, and I love talking about it.
You know, we were talking a little bit while the story was airing in terms of how important this is. You said 46% of gorillas.
Captive gorillas develop heart disease.
And you're still trying to exactly figure out why.
We are. There's a great big project that's called the Grade 8 Heart Project that's multi-institutional. It involves human healthcare professionals, veterinary healthcare professionals, all kinds of people coming together to try to better understand heart disease in grade apes. And this is just a small part of that.
Because of the genetic closeness that we have with the ape world, how much of what we've learned about heart health in humans is transferable to the apes?
We're learning from the human health realm, and they are learning from us. So it goes back and forth, yeah.
And then I would assume what you're learning here, you can apply to other animals in the zoo, or no?
Yeah, I think so. Okay. I think it's mostly applicable to the gorillas and then the chimpanzees. We've also been working to train our chimpanzees. They're a whole other story. They're a lot harder to work with, but we've also trained about 6 of our chimps for ultrasound.
And we should explain, because these guys are so docile when they're doing this and they're so cooperative, but these are still dangerous animals.
Yes. They're wild animals. We would never go in with them, and that's why we have to train them.
So why is Pende your type?
I don't know. He's just so handsome. He's so cute. Boyish good looks, maybe. I don't know.
Well, I love the fact that you let us.
Here, nice.
Exactly. Obviously, you're doing this with the gorillas in the heart. Are there other different things that you're doing with other animals that we don't know about? Well, this is really cool.
It is cool. One of the things we can do at the zoo is we have some of our lions and tigers trained to allow us to draw blood from them when they're awake. And the way that works is the door has a small gap at the bottom, and they've been trained to bring their tail underneath that gap, through that gap, and we condition them and they allow us to draw blood from them. And that's been excellent, especially for our older cats. Sometimes they can develop kidney disease or other problems, and we're able to monitor that while they're awake, which is... All right, I'm going to stop if I can figure it out. Where's the little button? How do I minimize this? Try this. There, it worked. This. And, no. Just go down. Here, I could just scroll down. Is it touch screen? There. There, you're on. Right there. Okay, all right. So, ooh. That doesn't look like the next slide, but maybe it is. Yes. Okay, so for this project, in addition to doing them awake, the first question that we wanted to answer is, how do awake measurements, cardiac measurements, compare to those under anesthesia? And that's an important question if you're going to stop using anesthesia to collect your data. And we found that our measurements were essentially the same, and that's good. That means that we can avoid anesthesia and still get good information. We also learned, as I mentioned, that 2 of the gorillas already had early signs of heart disease. And this was a surprise. At the time that we started, they were 13, 14, and 15 years old, and we were hoping we wouldn't find heart disease at all. But we did find a little bit of thickening in Chip and in Congo. And as a result, we started them on the medications that they would use for people. And since this original exam, we have been able to go back and do ultrasounds every 6 months. And that is, so that's been for 3 years. And we have seen a little bit of heart wall thickening at the beginning, but we think that we're seeing that that is stopping. We're going to have to follow them. This will be a long-term study over years in order to see how things pan out. The next question is, how are electrical abnormalities contributing to heart disease? And usually we do an ECG as part of a full heart exam during all exams, but obviously that's only occurring for a very short period of time and while they're under anesthesia. Implantable loop recorders are used to investigate syncope and arrhythmias that occur rarely in humans, people who have fainting episodes or other problems. And they have been used in chimpanzees. In the chimpanzee study, they immobilized them each time that they wanted to download the data, though, from the implants because their animals weren't trained to cooperate. And we thought we could train our animals. So we investigated the use of these. They continuously produce a bipolar ECG lead all the time. They can record 27 minutes of data. So whenever they record an abnormal rhythm or an interesting cardiac event, if they're full, they dump the earlier information. They give us all the arrhythmias that are any arrhythmia that's outside of the programmed stuff that's put in, including the time that it happens, how long it occurs, and they give us a print of the ECG. They give us daytime and nighttime heart rates, and they give us something called heart rate variability. They also have an accelerometer that gives us activity level. So we were able to train these guys in pretty much less than a week to present their back, like in the lower photo. And then we hold that thing that looks like a mouse up against their back. They only have to hold still for about 45 seconds and we can download the data. And we're able to do this every 2 weeks. So when we immobilize them for their exams, we surgically place these implants. They're about the size of a flash drive. We were able to put it into a sub-Q pocket, very much like what we've used for birth control implants in the past. It was a very similar procedure. It does have little holes where you can tack it into the tissue, which is important in order to decrease movement. We put it in the back because we thought that it would be easy to interrogate, and we thought that they might not pick it out that way. The chimpanzee study, they had some of the implants removed, and then we chose thresholds for asystole, atrial fibrillation, all the other types of things that we might be looking for. And these are the results. These results are actually very similar to another study that had looked at awake heart rates in gorillas where they just used a stethoscope, so that's good. We can see a difference that Chip's heart rate is a little lower than the other two. Nighttime heart rate is usually lower than daytime, and it is for these guys. The value that's highlighted for Chip we think is aberrant, that 205 for heart rate variability. Heart rate variability is a very valuable measure in people. It is a marker of your heart's autonomic function, its ability to respond to stressors. And it's a measure of the beat-to-beat variation. And it's useful for determining whether or not decompensation is occurring in people. And usually you have a lower value. You have less variability when you are decompensating. And so we can see the values there. We think that atrial fib is what's messing up his heart rate variability. And then for activity level, you can see the normal activity level for people, and ours are, actually the younger they are, the more active they are, something that I can see in that. We have had these implants in for a little over 2.5 years, and this is a summary of all the data from that. The implants are not foolproof. They detect things that are not real. And as a result, every report that I get every 2 weeks, some of them are up to 40 pages long, I have to read them from start to finish and look for what's real and what's not real. And there are, for Chip, he has a lot of bradycardias that are sensed. These are partly because he has a very low heart rate to begin with. He's also on a beta blocker, which lowers his heart rate. And they occur usually when he's sleeping. So we usually find them between 4 and 6 o'clock in the morning. He has some asystoles, or absence of heart rate, and these are all false. They're all very short. And then his atrial fibrillations are not real. I can see that he still has a heartbeat beating through them, but they're noise from the implant not having the best contact. He has, however, had some supraventricular tachycardia. These are recent. They happened in the winter last year. He hasn't had any since February. And we are going to be monitoring that again to see if it occurs during the winter months this year. This is what his data looks like graphically. His heart rate variability is going down, but we think it's false anyway. His activity level is going down, and he's the only chimp. There's actually 3 other gorillas for which I have data that I didn't put in this study, but out of the 6, he's the only one that had lowering activity levels. And we can also see that he is less active in the winter than he is in the summer. There's sort of a sine wave to that light blue line that's coursing across there. And that's true for all of our animals. The blue arrows down at the bottom show his treatment times when he was started on lisinopril and carvedilol for his heart disease. Pende, the middle-aged one, the handsome one, has also had some asystoles that are false. He has had 38 episodes of supraventricular tachycardia. These occur when he's up and moving around. Most of them are between 6 and 8 p.m., which you can see on the bottom graph. And these occur in people when they are under periods of stress or stimulants. And right now I have a camera set up at the grade 8 building. And if he hasn't had any episodes since May of this year. If he begins to have them again, we're going to start videotaping him to see if there's something happening just before he has these arrhythmias. I was also interested to see whether or not he was having them more in the winter months than in the summer months, and the graph at the top shows that that's not the case, at least with the data that I have so far. This is his big picture graph. His activity level is actually going up. He is less active in the winter months, however, and his heart rate variability is stable. He's not being treated yet. Congo has had no arrhythmias whatsoever, probably because he has a really good implant. But he is less active in the winter and he's being treated. So overall, we think that these implants are useful for detecting arrhythmias. This information, I think, is good for future comparisons with animals who have more severe disease that are identified in the population. They were very helpful for determining the proper dose of the meds that we have him on, particularly the beta blocker, because his heart rate dropped. And I think the activity level monitoring is actually kind of handy to have, and I think we'll be using that as we plan our enrichment programs and our management programs for the future. The challenges are that implant failure can occur, and the graph on the bottom is a gorilla from the Columbus Zoo, and you can see that he has data at the beginning of the study, but then all of a sudden all of the lines drop down, and they think that maybe he was, his implant came loose. Maybe he was hit by another gorilla when they spar, or it just came loose. And so his implant completely stopped working after it had been in place for a period of time. The inappropriate detections can fill up the recorder and leave no room for the stuff that is important. That's a challenge. We don't think it's necessary to use these implants in animals that don't have disease, but right now the Grade 8 PARP project is making recommendations to several of the animals in the population that have disease to have these put in. And I think there's some information here that could be useful for monitoring welfare, comparing activity levels between different institutions, seeing who's doing a better job of providing enrichment and opportunities for activity. So we embarked upon a similar project in our chimpanzees. We have 11, 9 adults and 2 youngsters. And they are not the same at all. I sometimes call chimps the attention deficit disorder grade ape. They are much, much, much harder to work with. Before going up to have a session with them, rather than looking forward to it with glee, I would have to evoke my Mother Teresa persona in order to maintain the proper amount of patience for this. My mentor called chimpanzees evil spirits dipped in shit. And along the similar vein, during this study, one of the chimps pelted me in the left eye with feces so hard that I had to go to an emergency room and have feces flushed from my eye for over an hour. The emergency room doctor said she couldn't believe that I hadn't passed out because no one had ever been able to stay conscious for that much eye flushing before. That was lovely. So, and in fact, I had post-traumatic stress disorder afterwards. For several months, it was very challenging to even go to the building. But we're back on good graces again. And now I wear a Sarah Palin mask when I go up there to dart them. So anyway, we are the first zoo to train chimpanzees for awake ultrasound. I'm very proud to say that. I wouldn't recommend you try this at home, though. We were able to do awake measurements on all of the animals. We don't have enough implants for this entire population because they cost $3,000 a piece. So we wanted to use our ultrasound measures to determine which animals were most at risk. And we discovered that 7 of them had one risk factor or another, whether they were male or on the older side or had one of their measures increased. This is Amara, the one who pelted me. You can see that it's not like the gorillas. He's not presenting himself enthusiastically at the mesh at all. But he was one of the best chimps to work with. You can hear a little bit of the chaos in the background. Another thing that you don't notice till you're doing this is that chimps have hairy chests and gorillas have naked chests, so the hair gets in the way. He's gone. So this is one of our best chimps, keep that in mind.
Good boy, Mark, right here. Stay. Stay.
I didn't show you the video where we have 3 different chimps in the same cage, all walking around trading off the whole time.
Good. These hurts the right, in the right spot. Good boy.
The other thing about doing this is it's like playing a video game where you're not holding the controller. I'm at the ultrasound machine telling her what to do. So we have placed implants in all 7 of those at-risk chimps, and all but 2 of them are on my desk. The chimpanzees take them out and hand them back to me. And unfortunately, most of this is the result of Trixie, our alpha female, our matriarch. She's a beautiful animal who informs all the other chimpanzees that they have been alienated by our implants and that they must remove them or she will do it for them. We have tried a new surgical technique on the last 2, and that has gone better. But you can see on the bottom right there is the opening where the implant was eventually removed. So basically, how much time do I have? 10 minutes. The animal welfare aspects are lots. Healthy animals can live more full lives. They can live more active lives. Certainly we see that in humans who have heart disease or are overweight. And they can have a broader range of natural behaviors, and that's what we're looking for. From a veterinary standpoint, this means far, far fewer anesthetic events in order to monitor health, and that's important. We are working along with this. We've been measuring urinary and fecal cortisol levels and trying to correlate that with behaviors. Because this is a bachelor group of males, we do think that that may be a more stressful way to be held as a captive animal than in a normal family group. And if that's the case, then we're hoping to weed that out through our data. And as I mentioned, I think the activity data is useful. And then I'm not going to play this video, but this is a video basically where we're saying that, you know, one of the biggest advantages is the gorillas really enjoy the work. They look forward to me coming if I go up there for another reason, to look at a boo-boo or look at somebody with the runny nose. They almost always run right over and present themselves for ultrasound because they like the challenge, they like the stimulation, they like the attention to some extent. But I think, you know, the other question that has to be asked here is if we have this prevalence of heart disease in gorillas and in chimpanzees, then should we have them in captivity? And I think with all things, if we learn through our work that gorillas and chimps cannot do okay in captivity because of heart disease, then we will have a responsibility to do something about that. And that is also at the heart of this work. I think that we may be able to come up with medications that can slow the thickening of heart disease, and I hope that that's the case. But if that isn't the case, then we will have to face that and decide what can we do. Do we need to house them in different groupings? Do we need to provide larger enclosures? What do we need to do? And so this data will all work towards understanding that better. I also want to thank the people at Medtronic. They donated 10 of these implants for this study, and we've made a couple of those available to other animals that are sicker than ours. The Grade A Part Project, who I've worked closely with. People at the Michigan Heart Group, where Dr. Alana Katinsky and Jan Halash work. They're the human cardiologists who help with this project. I have some volunteers that help me out, the veterinary team at the vet school, and then my very, very dedicated primate staff who work very hard to get these animals to cooperate for this care. Thank you. And I can take questions. Yeah, looks like I have time. Any questions?
Good morning, Ann. I'm Lori Penman. I'm asking this question as a veterinarian who oversees one of the behavior projects that's going on with the apes. You had kind of alluded to trying to match cardiac parameters with cortisol.
Yes.
So my question is, are you seeing a correlation? And my second part of that is, with recent hierarchical changes between Pende and Congo and Chip, did you see changes in heart rate, for example, or rhythms as those changes were made?
Yeah, so she's been working with us and with the researchers. We have a group called the Center for Zoo Animal Welfare at the Detroit Zoo, and their staff is doing the urinary and fecal, the salivary and fecal cortisol. And we don't know well enough. Extracting the heart rate data from the implant data ended up to be very, very difficult, and was going to take a lot of man hours for somebody to go through and look at beat-to-beat intervals and do calculations, and I couldn't do that. So they have the data, but have not done that yet. So I would say probably not. What we really need is to have 24-hour-a-day videotaping or behavior monitoring. They have done some behavior monitoring, and unfortunately, all of the arrhythmias have not occurred at the times that they've been doing the monitoring, as luck would have it. So I can't say that. With the cortisols, they have found that they think that, see if I can remember. I think Chip is doing better when he's inside and can see the other animals, and Congo does better when he's outside and can, I'm not going to speak to it because I'm probably going to misspeak it. But they have seen something, but nothing that helps us with the heart rate parts of it, unfortunately. I think that what we were looking for is when you have persistently elevated cortisols or persistently low, then you have to try to sort out whether or not the persistent low is because of lots of stress. And eventually, hopefully, we will be able to look at all of it and figure it out. But I don't know that I can speak to it yet. That was a very long non-answer.
Hi. So I'm actually really impressed with the amount of data that you're able to collect, and of course the longitudinal nature of this is pretty remarkable. Sorry, my name is Heather. I'm a first-year veterinary student here.
Okay.
I'm curious, I guess, about the things that we know about human medicine and whether or not you guys have been able to look at like the incidence of periodontal disease, or if you have a dental prescription or prescriptive exercise or increasing activity, and whether or not you've been able to monitor any changes in those variables.
Periodontal disease we take very seriously, and it absolutely is related to especially mitral valve disease in animals. We have excellent dental health at our zoo, so we don't see that, thank goodness. We have some animals that are immobilized every 6 months, primarily to scale and polish their teeth. In terms of the other things, the human heart people are the ones that are telling us how to interpret all of this and what to do about it. And so there is a similar condition in people. Basically, it's a thickening of the heart wall. It's very, very rare in people, and it responds. In fact, some people can have quite a large degree of heart wall thickening, and with the treatment, with the carvedilol and lisinopril, can see that actually reduce. Sometimes the heart wall stays thickened, but the function improves, and other times they can actually get the heart wall to become thinner again, which would be amazing. So,
what's the timeline on that for humans? Is it
I don't know. I had a human cardiologist tell me that he has seen patients improve almost immediately. I can't understand how that could be if it's truly fibrosis. So that's what he informed me, though. One of the cardiologists told me that.
Thank you very much.
Yeah.
Hi, my name is Sierra Emmons. I'm another first-year veterinary student. I was just wondering what is known, if anything, about cardiovascular disease in wild grade 8 populations?
And that's also, she's asking what's known about wild populations, and that is the question that seems the most important in a lot of ways. The Grade 8 PARP project group sent people to Cameroon last year to look at wild animals that are eating a wild diet, and they found less incidence of heart disease in those animals. They looked at both chimpanzees and gorillas. In this population, I took out the slide that shows that these 3 male gorillas all have the same father but different mothers, and the genealogy is a really important part of that. As people are looking at the population as a whole, the captive population as a whole, they are seeing that animals who have had heart disease, their offspring have a higher incidence of heart disease. So I think it's going to be multifactorial and very challenging to figure out, and I think that diet is going to be a part of it. I think that overall body condition will be a factor. Maybe the stress of captivity will be a part of it, and then genetics will probably play an important part. The genetics component is important in people who have the similar condition.
Thank you.
Yes?
Is this similar to idiopathic hypertrophic cellular stenosis or asymmetric septal hypertrophy in humans? Is that the same?
The second one, yeah.
Just the same, it's the same disease with a different name.
It is. And in fact, though, if you talk to the human people, they disagree about the name that it should be called as well. And so when you start reading about the different kinds of hypertrophic cardiomyopathy, it actually gets more confusing rather than less. And then how you can take the human picture and overlay it on this, it adds another level of difficulty to all of it. But they do see fibrosis. There are other hypertrophic cardiomyopathies in people where other things create the thickening, and we do know that the fibrosis is the hallmark of this one. So.
Any other questions?
Yeah. I'll repeat your question if you, okay.
My name is Austin Major. I'm an animal science major at Colorado State University, and I'm not much of a heart expert, but thank you. Thanks for the comment.
We do have one.
But wouldn't fibrosis occur in the heart as like if the tissue is damaged or like a heart attack or something? Is you know is the heart rate of gorillas normally faster than humans, or is it about the same level?
So the fibrosis does occur as a result of heart damage. So it's myocyte damage occurs, and then it is replaced with fibrotic tissue. So there's degeneration and or necrosis, and then fibrosis. That's the way that it goes. And we would expect their heart rate to be lower because they're larger than we are. Theirs are 65 and 75, which is probably about the same as a fit adult human. I'm thinking they're not as fit as some of the more fit adult humans that would have that heart rate. So I think they are trending lower as expected.
And has the heart rates of both captive and wild gorillas have been compared?
I don't think they know what the wild ones would be. I'm guessing it would be very similar, though.
All right. Thank you.
Mm-hmm.